10% of breast cancers are genetic. That's an important statistics. So we did a study in potentially the biggest cancer hospital in Australia for about 3 years altogether during the COVID times, and we looked at this exact question. The question we asked is, everyone who is being diagnosed with a breast cancer, irrespective of the family history, just because they were diagnosed with a breast cancer, we offered them the genetic testing. So the importance of genetic testing is to see whether they have inherited these genes from their parents, and that is the main cause for having a breast cancer. Now, what the results were astonishing. The fact that we always knew that 5 to 10% of breast cancers are genetic, but the biggest factor which was surprising for me is that about half of them did not have a family history of breast cancer. That's an exceptionally stark statistic, where I would have thought, yes, maybe 20% did not have a family history, but about half did not have a family history. So family history could be sometimes that exceptionally misleading due to two reasons. Number one, you might be a carrier of the gene, and then you might not get the cancer. Now, the classical example is that your grandmother, your mom has told your grandmother actually had breast cancer when she was 55 years of age, and she has died from it. But your mom, who's now 78, did not have any cancers, and there is no other family history. But now the daughter, who is very young, gets a breast cancer, and it skipped a generation simply because the mother was not, although she was a carrier and passed on the gene, did not have cancer. So you get a false sense of things actually all right. I don't have a strong family history. The second thing is that let's assume that you inherited these bad genes. When I say bad genes, there are numerous, and hopefully in my other videos I can tell about some of these genes. You inherited this from your father's side. Obviously, male breast cancer is not very common. So essentially, again, this could be very misleading, especially if you inherited this gene from your paternal or from your father's side. So for this reason, I think that unfortunately this is not funded even in Australia, but for someone who can have the testing, we usually strongly recommend get the testing done anyway, especially if you're worried about either due to a strong family history or you are diagnosed with a breast cancer and you are in a position to actually fund this yourself. Obviously, we hope that the government actually changes its policy and offer this to every woman. And we have seen, when I started my postgraduate studies, the selection criteria was much more limited for government-funded testing, but this has expanded. And this is reflective of all the guidelines, including the American, the surgical guidelines, etc. More and more people are alert to the possibility that you might have no family history, but still you might be carrying this mutation, especially in younger women.